And then imagine, okay, now Matt Ball, would I feel comfortable with him treating my daughter? But when we went to do the mega code, they were just all thumbs.
You are listening to EMS with your hosts, Erik Axene and Matt Ball.
Well, I feel like I always say that when we start a podcast. But this is a truly exciting day for ACE.
It is. Studio 3.0.
3.0. Not 2.0?
3.0.
Oh, that's right, because we started in the office.
Initially, yeah. It was small, and then we built our office.
Yep.
Or built the studio. And now our brand, we just got our CO here not too long ago, and we finished building the studio.
In this amazing sound studio.
And everything is foamed in. I mean, we even foamed the pipes.
Yeah.
Almost, some of them.
It's pretty cool. Very exciting.
So we do that. So the sound is better, right?
I
think the sound...
Does it make us look better?
I
hope.
I don't think so. Well, actually, I thought that with the higher ceilings now, the light's coming at us from new angles. So I think maybe we do look a little better.
Good. Younger.
Yeah. That would be the goal.
Of course. That's always the goal.
So what are we going to talk about today?
So today I was thinking we would talk about, as you know, I've been an FTO in my fire department for a long time. You're a medical director. So we both have been very involved in the training of new paramedics, specifically in our respective departments, and what it takes to pass a mega code with a medical director. You come in, I'm usually sitting in there. The way that we do it, our process has actually changed in my department, where the medical director actually isn't always doing it. Most of the time it's one of the FTOs that comes out to the station and does it. And so every department does it a little bit different, but that is a big kind of a rite of passage for a paramedic and EMT is going through their mega codes. I did not have to do that when I got hired on.
Yeah.
It was, that was a long time ago, and we didn't have to do mega codes. It was basically you got put with another firefighter, you rode 10 shifts on the ambulance, and they said, bing, bang, boom, okay, you're good. We didn't have to do that. Now they have to pass this mega code, as you do with your guys. So I thought it'd be good to kind of give some advice to those new paramedics.
Good idea.
That are approaching that or will be doing that if they're in paramedic school, kind of what to expect, what kind of a mindset to have from both the paramedic FTO perspective and then from the medical director, like what are you looking for in these mega codes? What are you watching out for? So if you like our podcast, you like our stuff, our new studio, be sure to hit the like button, subscribe to our channel, follow our podcast. We've been putting them out pretty consistently every Monday. And if you have topics that you'd like us to talk about, let us know. We'll certainly put that on the docket. Go ahead.
Well, I was going to say, when you mentioned that this would be a topic, and we got a great list of things that we're going to be doing, but this particular subject is something I've spent a lot of time preparing our process, which I don't think is too much different than most medical directors. It might be a little more involved than most places, but I think it's pretty similar. But
what is your process? What is the process in your department?
Yeah, so we have some things that don't involve me at all. I mean, they involve me indirectly, but as the protocol exam. Right. And then ride outs. There's a certain amount of period of time too, a probationary period where they're not quite eligible yet for the mega code, we call it.
Yeah.
So that mega code is after passing the protocol exam, after a certain number of ride outs, and then a certain amount of time and a certain amount of supervised ride outs. So I have some nurse educators that work with me, and I'll send them out on ride outs with the individual that's in the FTO process.
Interesting. So you have your educators come out, and are they, because your department has FTOs, do they not?
They do.
Yeah.
That's correct. And so my nurse educators who we work with, it's with a system of, I work with a consortium of medical directors, and we have a central location that has nurse educators. Right. And as part of their contract with us is they'll send them out, and we can utilize them in different ways. We've chosen to use them for part of the FTO process in doing a ride out. And I do ride outs too, and sometimes I'm on a ride out and then FTO's on shift, and then I will contact those nurse educators and say, hey, you know what, Matt Ball, I got him. We had some great cases together, some great trauma.
Right.
He did a fantastic job. I think he's ready to move to the next step. So
I've always found it interesting. We actually just had a meeting with a group of RNs, nurses, that are educators for paramedics, and I've always found that strange. As a paramedic and a nurse, I find that a very strange thing where you have nurses teaching paramedics, because I'll be honest with you, they are completely two different skill sets.
Yeah.
As a guy that's been a paramedic and I've gone through nursing school, I've only done nursing in a surgical environment. If you're an ER nurse, I would say that, as you know, that's very applicable to a paramedic. But the scope of practice, the mindset of a nurse over a paramedic is totally different.
Yeah, that's
totally
interesting.
different. And so anyway, just kind of an interesting side note that you guys have.
Yeah, that's a good point, because it's a different skill set. And I know the nurse educators that I work with are ER nurses that also were flight nurses. And,
then that's very applicable. Yeah, they know what it takes to do pre-hospital medicine.
Right.
Yeah.
But just, but that's something that to me is, they've got a lot of experience doing it, and they do it. But you're right, though. I mean, a nurse perspective or a paramedic perspective.
They have in-hospital nurses coming teaching paramedics, and I'm like, they don't have any clue that would be like me as just a paramedic going in to teach a med-surg nurse. Like, I don't have any idea what they do.
And you actually, we may have listeners right now in Arizona, for example. We have a lot of partners and customers out there in Arizona.
Yeah.
And all of the fire departments and EMS agencies have a base hospital.
Yeah.
And the base hospital is responsible for providing
Their
live education, and
yeah.
those are usually nurses or ER nurses that will come out.
Yeah, like I say, and again, this is not at all a knock on nurses. It's I can see where.
Yeah, you are a nurse. I mean,
well, yeah, that's why I got my nursing degree. So
you
I
got
can
the right
make fun
to
of
say
nurses.
anything you want about it.
I wouldn't go into ERs. Yeah, say when they're like, okay, ambulance driver, it's whatever, doctor, helper.
Yeah.
So.
Well, the same thing with doctors too, though. Like I have friends of mine that just assume I'm a surgeon.
Oh, okay, yeah.
Well, I mean, as an ER doctor, for the record, I'm trained to do the most, I believe, invasive procedure that anybody can do, the thoracotomy. Yeah. But it's not in an OR.
Right.
It's right there in the ER trauma bay,
yeah.
right? But I don't do appendectomies. I don't do cholecystectomy. I don't do hernias.
I'd say that
you know?
Yeah, the thoracostomy is a little bit more of a.
It is. But a lot of people think doctors are surgeons or surgeons. Right. You know, it's like we don't learn everything.
Oh yeah.
Now, if there was a profession that did learn everything, it would be the ER. I mean,
exactly.
You
have to be able to deal with
everything.
Yes, absolutely.
But we're not surgeons.
Yeah.
And that's interesting. But no.
Yeah, get us back on track with the FTO. So you've got nurse educators, you have FTOs. Yep. They have to ride out. It's very similar to what we do.
They've got to go through a process of different stages. We have it all. Actually, I don't know if your department, when you're listening to this, if you have something, but we put together a manual almost,
that's
you
what
know,
we have
and so we have different stages. I think we call them phases that we go through.
Yep.
And then the final phase would be the mega code.
Yeah, that's the same thing. Yeah.
And so with the mega code, what I do is the first thing, and as an educator, I understand how I don't have to be an educator to understand this, but there's a lot of anxiety.
Absolutely.
Along with my FTOs, we put together a process that is pretty rigorous. And you got to have your ducks in a line and know what you're doing.
Is this
or you
you're
won't
saying
pass.
for the mega code?
That's for the mega code, right? And I would say that I don't know that we've done this so many times, but I would say there's a certain percentage, significant percent of, less than a quarter, I would say, but a significant percent of FTOs of guys in the FTO process won't pass.
Yeah.
And they have to do it again. Yep. And I remember one case in particular. Where the individual in the FTO process, I could see that, and I knew they knew their protocols. Right. They went through all the process, and they had experience working with a private ambulance company. So I knew they'd had a lot of patient contact. But when we went to do the mega code, they were just all thumbs, and it didn't go well. Yeah. And so I said, with certain procedures, I'm going to take you to the cadaver lab. And we'll give you a conditional pass, basically, until you can demonstrate, mastery of these skills that you kind of flubbed up in the mega code.
So you actually have them do skills.
Yes, and so I brought him with me to the cadaver lab, and he did these skills on a cadaver with me. Yeah. And he had opportunity to practice. We worked with his FTO, and I knew he knew how to do it.
It was just nerves.
Because there's always a context with my students, or I call them students, but the individuals in the process. Yeah. Some are fresh out of school and they're 19, really young.
Little
and
babies.
Some of them have come from they've worked for a decade in a private ambulance company, and they became a firefighter, and now they're working to become that paramedic. And they're super experienced, and so when they don't do well, I kind of look at myself as like, oh, well, how have I failed a student? Well, what could I have done to have made this an environment where they can display what they know? Because I know they know it, and when they don't pass, sometimes I got to look at myself.
Yeah, but on the other side of the coin is the FTO. Mm-hmm. I don't think that's your failure, because it's not your job to prepare them for the mega code, in my opinion. In my department.
I agree. I hear what you're saying. I guess as an educator, for me, the way I was trained is when my students failed, like when I was teaching chemistry, right? Yeah. And a student failed my chemistry exam, I have to think to myself first, well, what have I done that may have not met that need for that student?
But you're not teaching the guy every day. That's my point.
True.
You're just coming in to do the mega code. The FTO is the chemistry teacher. He's the guy that's there every day, running them through mega codes, making sure, like when I would have new people, I would explain the whole process to them on day one. We would sit down and have a long conversation about, here's the expectation, this is what you can expect to happen, so on and so forth. And I would start off with very easy mega codes and explain to them the beauty of a mega code for those new paramedics that are out there. And like with my department, we started doing skills. But most of the time, like, you're not actually having to intubate a real patient. You're intubating a dummy. It's going to be super easy if skills are a part of it.
True.
You're going to get all your skills. Mm-hmm. Like ours used to be totally verbal, and so I'd be like, you have a huge stress relief because you just have to say, yep, we're going to crack this guy. You don't actually have to do it. You just have to say, yep, it's indicated we need to crack him. Okay, you've just cracked him. They're going to give it to you.
Yeah.
So that's, if you do a mega code where it's just verbal, that's a super easy part.
Yeah.
If you're a new person. I get that it's still stressful, but you're not having to, okay, I've made this decision that I have to do this extremely difficult skill. Now I've got to actually do it on a live patient. You talk about stress. That's why we put, for those people that don't understand, well, why do we have the doctor come in? That's part of it. Yeah. To have me as the FTO sitting there, maybe an EMS captain in there, the medical director in there, maybe the EMS chief in there. That's part of it, is to see, can this new guy perform under pressure? Because again, when you've got somebody's life in your hands and you're having to make critical decisions and do the skills, you have to be able to perform under pressure. Yeah. That's the entire point of the mega code, right? Yep. Like you said, most guys know their mega code, they know their protocols. They can regurgitate them to you verbatim. But when you put them in a stressful scenario, can they perform? And that's what it's all about.
And we'll get into the specifics of what I've built, but the way you set it up, though, I think, going back to myself reevaluating, when I have somebody that doesn't pass it, I got to check myself just to make sure that what I've built was fair and equitable.
Yeah, were my questions,
Right, because when I have somebody fail that I know is, really...
This is a knowledgeable guy. Like, why did this guy fail? Yeah.
And I also recognize, too, and we talk about this before we start our mega codes, is that, I remember one guy from a big department locally who came over to our department, and I knew this guy was a former FTO in his department. Yeah. This guy was going to pass, no problem. Yeah. And he actually didn't pass one of my cases. So when he didn't pass one of my cases, I went back and looked really hard at that case to see if there's something confusing about it, and we talked about it, and he just was off a little bit. It's not, but he knows his stuff, and no matter how hard I work to set up a situation, I know it's still artificial. Yeah. It's not a real patient, right? So.
And honestly, they'd probably perform better in a real patient. And you also have the crew there on a real
supporting.
patient. Exactly.
Because he's kind of on an island.
Exactly. In a mega code, it's all you.
And I want it that way.
Yes, and that's the way it's designed. Like I say, the stress is designed to do it.
So I'm going to take you through a mega code.
Okay.
We're not really going to do it, but the first case. So when I set it up, it's not just you and me. I have a scorecard, so it's objective. We take score.
I sat in one of your main
Oh, you did? Okay, that's right. And I think you actually were one of my evaluators, right? Yeah, so we have 3 evaluators, myself. It's usually the FTO and maybe an EMS chief or maybe the shift captain or maybe the battalion chief, whoever's available.
Right.
Sometimes some of my nurse educators are available too.
Right.
And they come in, and there's 3 of us in a panel, and there's usually a 4th person observing us.
Yeah.
Because we just want to be held accountable, right? And make sure that in the event that somebody didn't pass, it's not just me saying, I don't think you passed.
Right.
Because there's always subjectivity to it. We have a panel, and sometimes we're split.
Yeah.
And then it's nice to be able to go to that other person observing and then imagine, okay, now Matt Ball, would I feel comfortable with him treating my daughter?
And that's ultimately what you just said. A lot of people, it's so hard to put into words what is the standard we're looking for, because it is very subjective. But that's the exact same thing that we say is it's a level. Is the FTO are the people that have experience seeing firefighters and paramedics grow up. It's kind of an unspoken thing that you can see, like, yeah, this guy's got it, this girl's got it, like they got it. I'm not worried about it.
Yeah.
You just know, but that is like what I feel comfortable with Erik Axene responding to a member of my family and treating them. That's my mindset as an FTO and all of our FTOs.
And at the beginning, I share that too. Yeah. It's like, this is my barometer.
Say the same thing on day one.
And when they walk out at the end of the mega code, that's what we as evaluators discuss. And you experienced it. It's like, would we feel comfortable with paramedic Smith evaluating your wife or transporting your wife. Yeah. So those things are kind of set ahead of time. And I do, when you're sitting there in front of all the evaluators, and you saw this, is I just take a moment to set the stage and say, hey, listen, I know this is artificial. It's going to feel a little awkward sometimes because you're talking to me as the wife or the police officer. Yeah. That's the way I have it set up anyway, and it's.
Do you go into a girl voice when it's?
Sometimes. Well, sometimes you gotta talk
play it
a little,
Whatever.
Well,
and too, that kind of helps break the tension a little bit. Like it kind of this is kind of funny,
And I think they appreciate the fact that sometimes we don't take ourselves too seriously,
exactly.
And it lightens the mood a little bit.
For sure.
Yeah, but it is also, the reality is, sometimes their EMS division chief is sitting there with their medical director and their FTO and a battalion chief. I mean, it can be stressful when you're a 19-year-old, fresh out of school. It's a little daunting, right?
And it should be. I mean, and because, again, when you think about it, at the end of the day, like your medical license, they're working under your medical license. Right. And you want to trust that when they go out in the field, they're not going to do something stupid that's going to jeopardize all of us, right?
Yep.
And on top of that, you literally have people's lives in your hand. If you make a bad decision, you pick the wrong medication, you do the right procedure in the wrong way, there's 100 things that could go wrong. It is a big responsibility. I don't think people outside of this job realize the level of things that paramedics do.
And that's why I built this mega code, because I used to do it, and you experienced this too. Yeah. More conversational and go through, okay, you've gone through all the steps of the process and you've passed the protocol exam. Right. So I was protocol light in my mega code. I've gone back now to more of I address protocol issues, and we go back, and we'll talk about that in a second, but I think it's so important to take it seriously, because I want the mega code process to be something that means something.
100%. It shouldn't be easy to pass.
Right.
Yeah, it should be a rite of passage for every paramedic.
But it has to be fair and equitable, though. It's got to be
100%.
Right. Yeah.
Has to be
because I can
fair.
make something really hard nobody can pass.
So there used to be, we had a doctor formerly that would do our mega codes with us, and he had a case.
Is he the one that's coming to the studio later today?
No.
Oh, okay.
No. But this guy had a case that I didn't like. I didn't think it was a fair case for new paramedics, because it was more addressed a legal issue, not a treatment issue.
Oh, okay.
And like the first time I heard that case, I'm like, that's like, you could take a 10-year paramedic and they'd be like, I don't know what to do here. Yeah. And I had a conversation with him about it, like, I think this case is a little bit, and he was totally cool with it, and he's like, okay, that's a great perspective, and he took the case out. But now, do you do, like in my department, typically there's like 4 different scenarios. They have
Yep.
a medical, they have a trauma. Usually they'll have some sort of a cardiac with a 12-lead interpretation. Then you always have a pediatric scenario. And one of those obviously is going to be your full mega code.
Good question. So I'm going to back up just a step. So the first thing I will do just to get you feeling comfortable is I have an interview that we do, and we ask questions on. So what do you think are the most important traits in a highly effective paramedic? Yeah. And it gives them a chance to answer something subjective where there's no wrong answer. Yeah. And then it gets them feeling comfortable. Yep. And, it's like, hey, get
the jitters out.
Everybody wants you to be successful, Matt. All of us sitting here in this panel want you to be successful. We want to get you to a point where you can now demonstrate what you know. And I find that doing the interview, it's less for me, it's more for you, to get you feeling comfortable. Yeah. And then I will say, okay, we're going to pick a protocol now. And so I have, I make it kind of goofy where I say, okay, what's your birthday? You were born. What your birthday? Hold on. I know because was it June? No, July.
Yeah.
July 4th, 8th. Okay.
8th, yeah.
Sorry, Matt.
Oh, I don't remember. I know yours is coming up. It's in October something.
Yeah. Anyway, so 8, right? Yeah. So I'll go to the 8th item on the table of contents in our protocols in medical or something like that. And then I say, and so I'll click on, maybe it's OBGYN emergencies.
And they're all going, dang it, why didn't I have a different birthday?
And then I'll say, what's your phone number?
Yeah.
And then you'll list off your phone number, and the last number was a 6. So then I'll go to the 6th item, and it's eclampsia or something like that. Okay. And then I'll say, okay, Matt, so take me through the protocols on an eclamptic patient. Yeah. And then we'll have a conversation. And we'll keep going until you don't know something. So you're going to get to a point.
So they go all the way through the eclampsia protocol.
Yeah, and if they don't know something on the protocol, then they would fail that, and then we would do a new one and give them a second chance in finding another protocol.
So they have to know it all.
And I know they usually do because they usually score very high on our protocol exam. But what I do though is I dig deeper. Yeah. So what is it specifically about? We go through all the eclampsia, MAG, right?
Why do you give
why does MAG work? What is it like on the cellular level? What is about MAG?
Why would you give MAG as opposed to a benzo in eclampsia?
Yeah, right. And then they have no idea, and then we're done.
It's a teachable moment.
It's a teachable moment. We get to a level, I want to know how much they know. Yeah. And so we get to a moment where they don't know something.
Now, you don't fail them if they don't know.
No. I just keep digging deeper and deeper and deeper until they don't know something. Right. And so they know that ahead of time. Yes. So I say, you're not failing. Right. But, like the basic protocols for eclampsia, for example, is, you got a pregnant patient and you got the vitals, you need that. And then, giving MAG in a situation where you're concerned about eclampsia or maybe an eclamptic seizure. Yeah. So those are the basics, right?
It would be seizure.
Yeah. Our protocols are pretty bread and butter with each one, but then we have below them pearls. Of some of the pearls of management that and I'll draw from those and see how deep I can dig.
One piece of wisdom that I would give to any EMT paramedic that's taking their mega code is you should be allowed to take in a piece of paper and a pen. Typically, we let our new hires do that.
Absolutely, you should.
And I tell every single one of the people that I've trained, I tell them this, and I bet less than 10% of them listen to it, and they screw up because they didn't follow this simple advice. When you get in there, write down, first off, ask for every single vital sign possible. Why would you want to limit your intake of information because you're being judged on your decision? Yeah. I want every single bit of information I can get. Because again, this is fictitious world. Yeah. So I want to know everything I can possibly know, right, before I'm making a decision that I am being graded on. Yeah. So I would tell them, when you get in there, write on your piece of paper all the vital signs you want and write down everything. I want to know heart rate, blood pressure, SpO2, end tidal, blood sugar, temp, GCS, A&O status. I mean, I want to know everything. And I write it down because I tell them, you're going to go in there, you're going to be super nervous, and you're going to forget to get a blood sugar. Yeah. And you're going to have
get them all right away.
Get them all right
That's
away.
Great advice.
And then you go in, and that unresponsive patient, and you forget to get a blood sugar, and now you're RSIing this patient because you're thinking it's an altered mental status, and the doctor looks at you like you're an idiot and goes, well, their blood sugar was 20.
Yeah.
I didn't get a blood sugar. If you write it on your paper,
or maybe that sepsis patient.
Or the septic patient, get a temperature. Yeah, exactly. So write all those vitals down.
Great advice.
And just write that on the piece of paper. Ask for everything before you make that decision.
You know, I tell that, you know, when I do have somebody who maybe needs some extra help, I'll go and try to help them build like a framework where they collect the data and write it down. There's no magic way to do it, but have a system that you use.
It's your assessment, doing a proper assessment. Use your sample, use your OPQRST.
So whatever you're comfortable with.
And that's what the FTOs should be teaching them before they get
and
with
they
you.
They do.
Yes, ours do as well. We sit down at our smoking table in the bay, and I would go over 2 or 3. And like I said, I would usually start off with pretty simple ones, and then they would get progressively more difficult as their training went on. And by the end, I mean, I'm giving them full on, like, okay, here you go. You got to figure this out. Prep them as much as I can, because I know that I can't replicate that nervousness that they're going to feel. And so I make sure that they have all the protocol knowledge, all the didactic knowledge that they need before they go into that thing. And hopefully, and some of them, you know, it's based on effort. If you study your protocols on your day off, if you're putting in the work, you're going to do fine. I've had guys absolutely kill it in there. And then I have guys that, one of the things that we look for, it's sharks in the water. If I'm doing a mega code with somebody and I'm like, okay, you're going on this patient, go. First off,
Clearly hasn't practiced.
Like, okay, this guy's all over the place. Like, what, and you tell me what you look for, but I know what I look for when I'm doing this, is I want them to be confident. Fake it till you make it. Walk in. Okay, I'm going to walk in. How does my patient present? Your patient's sitting up in a chair. Okay, I'm going to go up and introduce myself. Hi, my name's Matt. What's going on today? Oh, I'm having some chest pain. Okay, he's having chest pain. How does my patient look? Is he pale? Like, they're just, and then as soon as that student, rookie, whatever, the guy taking the test, as soon as they're acting like that, it's like, oh, this guy knows this stuff. Like, you can just tell the confidence is exuding, and they're hitting all their benchmarks on top of it. But when you come in there,
I will say this, though, too, is I've had guys that come in that are very, and girls too, that are very confident, and sometimes that hubris sort of
that's like, pride, not confidence.
Right. Yeah. No, it's, I would prefer to have somebody who's, you know, well, ideal, it would be nice to have somebody with the confidence and the knowledge, right?
Yes.
I feel like I can build the knowledge, no problem. I can work with them. But I'm seeing more and more and more of my students or potential FTO or paramedics come in lack of confidence. I'm wondering if it's because of all the screen generation stuff where people just aren't used to talking to real people. I don't know, but these young kids that are coming in, some of them just are all thumbs with just talking to me.
Yeah.
They're freaked out,
face-to-face yes, that's a huge issue I've seen with patients, patients. I don't know what the answer to that is. Confidence is a big deal, but I think even when I think back to when I went through school and all the years that I've been training people, that's always been an issue.
Yeah.
That I think that somebody either has confidence or they lack confidence. And I think that that's partially the FTO's job, is to instill that confidence in them. That's the medical director's job. Practice. And it's their job.
Yeah.
You know, you as the new person, you've got to be putting in that work. Your FTO, your medical director, your crew can only help you so much. And I basically have told my guys this, that I will climb the mountain with you, but I'm not going to put you on my shoulders and drag you up.
I've used that before. I remember you saying that.
Like, I will be right here next to you, struggling with you, going all the way through it, but I am not going to carry you up this hill. You're going to have to put in your work. You're going to have to do your part, and if we both do that, you will succeed.
Yeah.
But most of the time, because the FTOs have done it, they're so practiced in doing it, they can run up the mountain. It's the new hire that doesn't.
And I think you know, the last part again, as we finish up here, are the actual cases.
Yeah.
So I have the FTO, or each member of the panel picks a case, and we make sure that there's a variety of cases, and each case has a set of critical actions.
Yep.
So as we listen to them take care of the case, we're adding points.
Right.
It's all in the scorecard. Yeah. And they have to get a 70% at least and hit all the critical actions.
That's what we do.
So if you miss a critical action, or if you get all the critical actions but you're below 70, you don't pass. Or if you get over like 100% but you missed a critical action, you didn't pass.
Right.
And you don't have to pass all 3, you got to pass 2 of the 3. Okay. And even if you pass everything in flying colors, if there's something about that paramedic, potential paramedic, you know, that we feel uncomfortable treating a family member, as a panel, we will agree that there's some sort of a remediation. Like I mentioned that guy that had to go to the cadaver lab.
Yep.
That was just something we needed to see before we would pass him. So that's the process. I will share one thing though, and is that I'm excited to add a new variable to our mega code. Is I'm going to start doing time limits.
Oh yeah.
To add the pressure of time, to make it even a little more realistic. Just add a little pressure.
So hardcore.
Well, I want to make it as helpful as I can.
Yeah. No, that's good.
That's good stuff.
See you on the next one. Next
you out there.
studio.
Thank you for listening to EMS, the Erik and Matt Show.